Hey everybody, it's Dr. Lisa with Tri-State Veterinary Services. Wanted to touch base with consumers and clients regarding the high-path avian influenza outbreak in dairy cattle. So for those of you that don't know or aren't aware, there was an outbreak of what was come to find out to be actually avian influenza, also known as bird flu, in dairy cattle in the Texas Panhandle. And that started back in March, and since then it's spread to a few other states, as north as Wisconsin and as east as North Carolina. What we're finding is that it's causing dairy cows to become sick, drop in their milk yield, and cause mastitis. It's also been afflicting cats, birds, causing fatality and neurological signs, and it has been seen in some human cases. These people are experiencing flu-like symptoms, and the only cases that have been seen are humans that have been working alongside these dairy cattle where they've had the outbreaks. So it's still pretty preliminary, but the governing powers that be, such as the USDA, APHIS, and also associations such as the American Association of Bovine Practitioners, have all been working tirelessly to make sure we keep this as contained as possible, and we stop the spread, and we make sure that all the animals and people involved are safe. So for more information regarding the actual outbreak itself, you can visit the USDA APHIS website. You can also go on our website. We've linked on our homepage direct links to a lot of the information that's coming out regarding guidelines, biosecurity, testing, travel, as well as what to look for and where different cases are happening. So I'm going to leave it at that for the sake of not making this video 10 hours long, but I do want to go over 5 brief things to just clarify some stuff and make sure everyone's on the same page. So first and foremost, where is this going on? So again, it started in Texas. As of right now, there are no cases in New England, including Connecticut, where we are located, nor are there any cases in New York or Pennsylvania. The closest to us over in Connecticut we've seen is North Carolina as well as Ohio, but as of right now it has not entered. That's not to say that it can't. So that's where the following things I'm going to talk about are ways that we can prevent it from spreading even farther and coming over to the East Coast. For a day-to-day updated information as to where cases are and what states are positive, you can go on the USDA APHIS website. They are updating it daily as to what states have had positive cases. Again, that will also be linked on our website, so you can find it there as well. Number 2 is food safety. Is the food safe? We're talking our dairy supply as well as beef supply, and the answer is yes, absolutely. So for 2 reasons, the dairy supply is 100% safe. One is that pasteurization has been proven to kill this virus and make it completely inactive in the milk. So even if it is present, it is killing it. You do not have to worry about getting avian influenza, bird flu from your milk, as long as it's pasteurized and you're purchasing it from the store. Also, any cows that are showing symptoms or signs are not going, their milk is not entering the food chain at all. But again, even if there was in the food chain, which it is not, the pasteurization would take care of it. And in regards to beef, they have been testing all different beef samples from positive animals, negative animals, all trying to figure out if it can be tested in the beef. And the answer is no, we're not finding it in the beef. So as of right now, meat, 100% safe, milk, 100% safe, as long as it's pasteurized. So the third thing, and this is more for the producers rather than consumers, but in regards to travel restrictions, there's a lot of information, what's going on, where can my cows go, this and that. Absolutely, number 1, if you have animals that are traveling anywhere, in the state, out of the state, wherever, whether they are beef, whether they're dairy, I highly recommend that you contact your veterinarian and ask what you need to travel those places. Because even prior to the avian influenza outbreak, there are absolutely testing that needs to be done for different states, as well as you need a certification of veterinary inspection or a CVI if animals are crossing state lines. No matter what, that's not new. So now that we have this avian influenza outbreak, the new mandated testing is for lactating dairy cows crossing state lines. Those animals need to have a negative avian influenza test within 7 days of travel. So that testing is actually being done on milk and can be sent to specific labs in the country. Again, contact your veterinarian if you have lactating dairy cattle crossing state lines. You will need this testing done within a week of travel. So contact your vet, arrange for it. As of now, the USDA and APHIS are paying for the actual testing. However, the cost of veterinary services, the CVI, and shipping of those samples are at this point not being covered, but the test itself is covered once it reaches the lab. There are some specific details in regards to animals going direct to slaughter or animals moving within the state. I, again, very much recommend you contact your veterinarian with specific questions, as well as look at the guidelines that we have posted on our website. But the big thing to know is lactating cows moving across state lines, you're going to need that testing within 7 days and a CVI. No way around it. The fourth one is biosecurity. So again, we want to make sure that wherever the virus is, that's where it stays, and we're not spreading it to different places. So the big thing is any animals that have left the farm, whether it be for show, for sale, and are coming back on the farm, or animals that are newly purchased and coming back on the farm, make sure you're quarantining them. The recommendation is about 2 weeks. Now, as of now, the avian influenza has not been shown to be transmitted between the cows through respiratory or breathing, ventilation, but it is being passed through the milk, as well as it could be from blood. So we recommend that you keep them separate. The farther away, the better. And no nose to nose touching. Make sure that you're changing gloves between breedings, changing needles between cows to make sure we're not passing anything along that way. And always make sure that you're using proper milking procedure. If you are somebody who travels to different farms, maybe you're a breeder, maybe you are a transporter, anything like that, make sure that you have, you're cleaning your boots, disinfecting. An easy thing to do is just carry a scrub brush and some dish soap, or even just a spray bottle with some diluted bleach in it. Spray your boots, make sure you're getting all material off of it prior to going back to your own farm. As well as, again, make sure you're changing gloves and things like that so that you're not tracking something from one farm onto another. Lastly, what do you look for? What do you do? So anybody who owns cattle, specifically dairy cattle, what we're finding is that these positive cases, the animals, the cattle are dropping in milk yield. The milk is almost becoming thick, like a colostrum-like consistency, causing a mastitis, and then these animals just completely dry off, as well as they are showing signs of flu-like symptoms. So fever, going off feed, acting lethargic, those kind of things. If you see anything like that in your cattle or any ruminants, make sure you're contacting your veterinarian. Again, right now we're not seeing a lot of it in beef, but have your eyes out if you're seeing these symptoms. The other big things to look for is if you are looking, if you're finding any dead birds, so whether that be domestic poultry or wildlife, especially waterfowl on your farm, on your premises. If you're finding dead birds, neurologic or dead cats, and even dead rodents on your property, that is something else that is commonly been seen in these positive cases. So if you're seeing that, make sure that you contact your veterinarian immediately. What's going to happen then is your vet is going to contact the state department, and from there, kind of the wheel will start working. But immediately contact your vet. And for anybody who doesn't have a strong relationship with the veterinary practice at this time, and our livestock producers, I highly recommend that you develop that relationship. This is not something that's going to go away immediately, and the testing is definitely mandated, and we're going to move forward with it. So you're not going to want to wait until last minute to find a veterinarian to help. So again, that's a whole whirlwind of information. Please visit our website where you can see the guidelines more specifically drawn out, as well as you can visit the USDA APHIS website to get those specific guidelines. Any questions, feel free to contact us if we are your practicing veterinarian or your veterinarian that you have for your farm. Thanks so much for tagging in. It was a long one. Thanks for hanging in there. Have a good rest of the evening, guys.